Hello everyone, welcome back to Medical Coding Club. This is Chandrika. So today we will see one of the most prominent E&M services, that is hospital inpatient and observation guidelines, as well practice questions. So I have added IP discharge, also same day admit and discharge. So I'll try to cover in an easy way. So please watch video till end, and if you find it useful, please do subscribe to my channel and please do share with your medical coding friends. Let's get started. So firstly, as we are discussing IP services, please be aware of what is initial visit and what is subsequent visit. So an initial visit refers to a first encounter between patient and healthcare provider for the particular condition or a problem. So this is when the day the patient get admits. So during an initial visit, the healthcare provider conducts a comprehensive assessment, gathers a medical history, and performs a physical examination and develops a treatment plan. The complexity of the visit and the extent of an evaluation and management are typically higher during an initial visit. So as we know, during an initial visit, the provider has to spend more time with the patient because he needs to gather more medical information about the patient, and he needs to evaluate the patient thoroughly to develop the treatment plan. So usually provider will be spending more time in the initial visit. So as a provider need to establish a baseline understanding of the patient health status and formulate the appropriate course of action. Okay, so just remember, in initial visit, it's a visit that refers to a first encounter between a patient and healthcare provider. Next, subsequent visit. Here, the subsequent visit is also known as a follow-up visit, occurs after an initial visit and involves ongoing monitoring and management or a treatment to the patient condition. So a subsequent is like today the patient is getting admitted will be considered as initial, and the next day of the admission will be considered as subsequent. So in the subsequent, generally the physician will come and will see the patient, like how this patient is responding to the medication or any kind of changes is needed in the treatment plan. So they'll check, and accordingly we have to select the E&M level also. So keeping this in mind, we will see the codes and will understand the coding guidelines. So here we have hospital inpatient observation services coding guideline. So previously, as you know, we had a separate code for observation care, but now we don't have any separate code for observation. It is also included in the hospital IP codes. Okay, but the coding guidelines are very important. So whenever we are dealing with the IP scenarios, we should be really careful because each coding guidelines are unique, and we have to know when to apply these coding guidelines. So, for example, the first coding guideline is observation status. Regarding observation status, they are saying does not require a designated area. The care provided anywhere can qualify as observation services. So people will be like seeking for the validation about observation unit. Okay, it's not like any unit or any kind of room. It is about what kind of treatment that patient is getting, like whatever the specialty it might be. Maybe patient is admitted in emergency department or in the hospital floor or in the outpatient setting. But the what most matter is like what kind of treatment he is getting. The intent to monitor the patient conditions to decide on further treatment or a discharge. Okay, so if he is pronounced as an observation status, then you can consider it as a IP codes. Okay, the next, continuous services. So continuous services spanning 2 calendar days should be reported using the date of service began. So for the hospital IP also we can follow both MDM coding guidelines and time coding guideline. Okay, So whatever the way it might be, whether you are coding for MDM or coding for a time, spanning 2 calendar days, that is continuous services. Say for example, today at 10 o'clock, okay, today at 10 p.m., maybe provider started doing a service. Maybe they started doing kind of surgery or kind of any minor procedure, and it ended around 12:30 a.m. Okay, 12:30 a.m. So now 10 p.m. to 12:30 a.m. So like today is a date, today's date and tomorrow's date will be calculated. But what will happen now? You cannot bill it for 2 calendar days. Since it's a continuous service, they started at 10 p.m. on this day and they continued procedure up to tomorrow 12:30 a.m. So there are around 10 to 11, 1 hour, 11 to 12, 1 hour, almost 2.5 hours. They did a continuous service. Okay, though the dates are falling in a different calendar dates, we cannot bill it for 2 different days because it's a continuous service. Okay, so whatever the it may be time, if we are billing for 2.5 hours, based on 2.5 hours, whatever the level we will get, we have to bill. If we are billing for MDM, we have to check for the all the problem address data and risk, and we have to code accordingly. Okay, but if the patient was in the maybe they have did a multiple visits, okay, they did not do continuous service but they did a multiple visit, in that case we would have given with the 2 calendar dates. But when the service is continuous and it might be falling in a 2 different calendar days, you cannot bill it for 2 calendar days. Okay, so that is the meaning of continuous service. Next, modify 25. Apply when additional visit occur at a different site on the same day and indicating that separate and significant services. So as we know, if we are billing any 2 ENMs, we will be utilizing 25 modifier. So and with the any of the ENM, if we get any significant services, we have to utilize the 25 modifier. And same day consultation, use subsequent care codes for consultation or admission occurring on the same day. So that meaning is the physician has taken a consultation with the patient and they're already billing for a consultation initial visit, and then the same day that same patient got admitted. Okay, so here you cannot again go ahead and bill IP initial codes. You have to take it as subsequent because you already billed consultation initial. So for the admission purpose, you have to go with the subsequent ENM codes. Subsequent ENM codes. Next, prolonged service. Report the extended care in observation or an inpatient setting using 99418. So in previous video, I have clearly explained on how to use 99417 for outpatient setting and 99418 for IP setting. So if you please go back and watch that video if you have any doubts. So here if we are using time to code IP services, and if we meet prolonged service, then we can utilize the add-on code 99418. So initial visit codes, apply these codes for a very first encounter during an inpatient or an observation care. So as we know, I have already explained, initial visit must be the first encounter between patient and physician. So only that kind of visit will consider as initial visits. Next, shared specialities. So here the shared specialities are like what to say, physician assistants and this advanced physician, a registered nurse, okay, are deemed to share the specialty, subspecialty of their supervising physician of billing purpose. Okay, so these are people all be considered as same specialty people. Okay, and next, covering physician. Considered to have the same specialty as the physician, they are covering, ensuring that consistent billing. Say for example, one provider who is on the regular basis, he was on leave. Okay, he is not available. So to replace that particular physician, the covering physician should be from the same specialty. Okay, so then only we are able to bill it properly, or else we will have the issue in reimbursement. So covering physician must be from the same specialty. And then discharge day management codes 99238 and 239. These codes are based on time. So first day after coding initial and subsequent, and for the longer stays, like when patient is getting discharged, IP discharge, we have to utilize these codes to build discharge summary. Okay, so we have to check time, and based on that we have to utilize. So we'll see all the codes and we'll understand. So I hope you have gotten one clear idea on coding guidelines. If you have any doubts, please comment so that I can clarify. Maybe like it is not in a simple way, I have just tried to explain in a single slide. Okay, so if you want it more simpler way, please do comment and I will respond and I'll help you with that. So hospital inpatient and observation care codes here. This hospital observation services, these are the initial codes. The initial IP code starts from 99221, straightforward MDM, and time 40 to 54 minutes. And then 99222, moderate MDM, 55 to 74 minutes when considering time. And 99223, medically appropriate history and exam, and it is high MDM, timing is 75 to 89 minutes. Up to 89 minutes you can bill 99223. And these are a prolonged service codes. G series is a CMS code, you don't need that. That AMA code is 99418. So if you meet more than like if you get 90 minutes, you can take 99223 and 99418. Okay, so for each 15 minutes, additional 15 minutes. Okay, 15 minutes you can consider 99418. And subsequent visit starts from 99231, straightforward or low, time is 25 minutes to 34 minutes. 99232, moderate MDM, 35 minutes to 49 minutes, you can consider 99232. 99233 is 50 minutes to 64 minutes, you can consider 99223. And again prolonged service code 99418. If you meet 65 minutes, then you are supposed to code 99233 and 99418 both together. Okay, so if you get extra 30 minutes, then you have to give the 2 units. Okay, and coming to discharge. So inpatient discharge, we have 2 codes 99238 and 239. So here 30 minutes or less. If discharge, whatever the when patient is getting discharged, the time, the amount of time spent from the physician, and maybe he can give a follow-up care or some kind of instruction, general instruction, or he might be given instruction on medication, whatever it might be. So we have to see the discharge summary. In that, if the provider has spent less than 30 minutes, you have to code 99238. If provider spend more than 30 minutes, then you have to code 99239. Okay, and these IP discharge codes are, you have to code them with IP services only. Okay, so this is the overall code set we have for hospital IP and observation codes. So we'll quickly see few practice questions for your better understanding. So here you can see a 67-year-old male is admitted with a new onset chest pain. The provider performs a comprehensive history and physical exam. Medical decision making is moderate complexity, involving differential diagnosis such as myocardial infarction, pericarditis, and esophageal reflux. Provider orders an EKG, cardiac enzyme, and monitor the patient overnight. So a differential diagnosis you don't have to consider, but here the medical decision they have already given, it's a moderate complexity. Okay, so in the IP setting scenarios for your CPC exam, it will be very direct. Okay, you just have to be aware of coding guidelines, that is enough. But considering MDM or the time, that complexity you will face only in ENM outpatient setting. So when you are dealing with IP question, they'll directly give MDM is a moderate, MDM is low, likewise. So here MDM is a moderate complexity. So if you see a new onset chest pain, okay, admitted. So this is an initial visit. Okay, initial visit, MDM is moderate. So the answer must be 99222. Okay, 99222 will be the answer for this particular question. And next question, a physician spends 92 minutes face to face with the patient during their initial hospital visit, and includes time passed records evaluating the patient, counseling, documenting encounter, focusing on stabilizing hydration. So code based on time. So here 92 minutes this provider has spent with the patient. So you have to check this. Again, this is an initial hospital visit. So if you check 90 minutes, you have 92 minutes. Okay, so we are getting here. That means we are meeting a prolonged service code, so that we have to utilize 99223 and 99418. 99223 will be the highest level, and 99418 we are using for each additional 15 minutes. So we have additional 17 minutes. We have additional 17 minutes, but for 15 minutes we will give 99418. For additional left out 2 minutes, you cannot consider any extra units, because to give one more extra unit you need 15 minutes compulsory. Okay, so if you are not meeting 15 minutes, then you don't have to take one more units. So that extra 2 minutes you can ignore. So the answer is 99223 and 99418. Okay, 99418 is a prolonged service add-on code. We will utilize only for IP setting. Same way for OP, we will utilize 99417 for outpatient setting. So the next question, physician performs a medical review and documentation on 83-year-old patient who has been in the hospital for the last 2 days with a confusion, problem focused exam where she alert and oriented for 3 days today, and the medical decision making, the low medical decision making by ordering an echocardiogram and continue IV fluid. Patient is not safe to return home. What is the ENM code? So they have clearly mentioned this is 2 days with the confusion and low MDM. Okay, so 2 days means we are billing for subsequent. If it is an initial admission, we would have considered initial visit, but here it's already been 2 days, so that we have to go with the subsequent visit. And also they have clearly mentioned low MDM. So if you see low MDM, 99231, straightforward or low MDM and subsequent visit. Okay, so the answer must be 99231. And next question, the physician spends 40 minutes on the third day of hospitalization evaluating the patient recovering from severe asthma exacerbation. This time include face-to-face interaction, reviewing the patient progress and discussing the discharge planning. So here the time-based coding, 40 minutes on the third day of hospitalization. So again it's a subsequent visit. Check for 40 minutes what you will get the code. So you can see here 40 minutes 99232 and 99233. 99232 we have 35 minutes to 49 minutes. 35 minutes must be met or exceed. 99233 starts from 50 minutes. So that the answer must be, so we have 40 minutes, it falls between 35 to 45, 49 minutes. So the answer must be 99232. 99232 will be the correct answer. Okay. So again one more question, it is based on IP only. So 72-year-old female admitted for hospital with a confusion and dehydration. On the first day, physician performs a comprehensive history, orders IV fluid and moderate MDM. On the second day, the physician evaluates the patient improved condition, performed problem-focused history and straightforward MDM. Okay, and on the third day, physician spends 30 minutes discussing the discharge instruction and coordinating follow-up care. Okay, so here please go back and refer the CPT codes. So here we are, they are asking for 3 days codes. The first day is initial service. Okay, so initial service they have performed moderate MDM. So the first day we have to bill for moderate service, and the second day it is straightforward MDM. Okay, straightforward. And third day, if you see, the physician spends 30 minutes discussing the discharge instruction. So you have to code from discharge IP discharge codes, as I said, based on time. So 30 less than 30 minutes we have one code, and more than 30 minutes we have one code. So we have to check those code and we have to give the answer. So if you see here, 99222, 99231 and 238. So I will not answer for this question. So please take 2 minutes time. Just go back to the codes and refer. For moderate MDM, what is your initial code? For straightforward MDM, what is your subsequent code? And for the 30 minutes, what will be your discharge code? Okay, and you can write your answer in the comment. If you're wrong, I can correct it there. Okay. So let's just move on to one more important coding guideline. So here again, this is also one more important E&M service. Same day admission and discharge of hospital, IP or observation care service. So as name says, same day admit and same day discharge. So there are few guidelines for this particular concept. So the duration is very important. Okay, though the patient can get admit and can get discharged on the same day, there is a duration eligibility criteria. Okay, if patient is admitted and discharged on the same day, the total duration care must be more than 8 hours. Okay, so if patient is getting admitted in the morning and if patient is getting discharged in the night, okay, at least by 9 o'clock 9 p.m. So if you meet more than 8 hours criteria, then you have to code same day admit and discharge codes. Okay, and if you don't meet 8 hours, if you may be meeting only 6 hours, okay, if you meet 6 hours, then you have to code the IP initial codes. IP initial codes. Okay, and if you meet more than 8 hours, then you can utilize same day admit and discharge codes 99234, 235, 236. So these same day admit and discharge codes also you can code based on MDM and time. So whatever they are asking or whatever the guideline which is giving you an highest reimbursement for the particular scenario, you can follow that. And stays less than 8 hours, as I said, we will utilize IP initial service codes. And again, condition for use, the physician or qualified healthcare professional must be provide both admission and discharge service on the same calendar date. And discharge code excluded, discharge day management 99238, 239 are not separately reported when using same day admit and discharge. So as we know, the same day admit and discharge, these 99234, 235, 236 covers admission and discharge. Okay, so you should not utilize any additional discharge codes Okay, it will be a double dipping and you don't have to use that. So just check for the minimum duration, that is 8 hours. If you are meeting more than 8 hours, like say for example you are getting 10 hours, then you are eligible to code for same day admit and discharge. You can go ahead and you can see the MDM or see the time, based on that you can assign the ENM code. And if the more than 8 hours and if you are getting different calendar dates, then again it completely goes to IP. You have to code one day initial service, next day you have to code subsequent, and whenever patient get discharged you have to code discharge code also. Okay, so this is a brief overview on same day admission and discharge. We'll see codes and we'll see one question also. So yes, here you can see there is a one practice question. A 67-year-old woman presents with an emergency department with a severe abdominal pain and nausea, which has been ongoing for the past 5 hours. Upon assessment, the physician performs a detailed examination on ordering imaging, CT scan abdomen. Physician determines the patient requires an observation for more than 8 hours. That resulted for her CT scan will not be available for 3 hours. Patient needs an IV fluid monitoring due to another condition. Physician also provide moderate medical decision making. Document and careful. The patient remains hospital more than 8 hours and before being discharged on the same day. Okay, so patient admitted and stayed more than 8 hours and got discharged on the same day. And if you see, they have provided moderate decision making. So these are the codes for same day admit and discharge: 99234 straightforward or low, 99235 moderate, 236 high level, and this is the time description. Okay, so if we follow MDM for the particular question, they are saying moderate medical decision making, and stay must be at least 8 hours. So we have met more than 8 hours and MDM is moderate. Okay, so we are getting 99235 as our answer. 99235 will be the correct answer for this particular practice question. Okay, so you can see this table also. Less than 8 hours means we code inpatient initial code. More than 8 hours means we code same day admit and discharge. And admit on one day, discharge on another day, then we have to code initial code, subsequent code, and also discharge codes. Okay, so yes guys, like I have tried to cover both IP and IP observation guideline and same day admit and discharge guideline. So if you have understood, well and good. If not, please comment or reach me out. And yes, that's all for today actually. And the time is, you don't believe, the time is 1:45. Okay, 1:45 a.m. It's midnight. So I am like, without posting the videos, it will not be good. Okay, so after my work, I have to take classes. After classes, I am doing this PPT and I am making this video. So I will, I don't want to lose any hopes. So please do subscribe to my channel and please share with your medical coding friends. And I, from my end, how much ever content I can create, I will try to create. Okay. Okay. Thank you. Thank you for watching. Bye bye.